Hello students, my name is G. Nikita, M Pharmacy, Assistant Professor in Department of Pharmaceutical Chemistry. I will deal the Medicinal Chemistry 2 for B Pharmacy 3rd years, first semester. So today we are going to discuss about drugs used in congestive heart failure. It is the third unit. So in this we will discuss introduction means what is the congestive heart failures and what are the signs and the symptoms, what are the types of the congestive heart failures, classification and what are the drugs has been used in the congestive heart failure, mechanism of action and structure, adverse drug reactions and uses. So these are the topics we will discuss in this unit. So before discussing about the drugs, what are the drugs used in the congestive heart failure? Let's discuss what is the congestive heart failure. So congestive heart failure is defined as the insufficiency of heart to pump the sufficient amount of oxygenated blood to the organs of the body to meet their normal metabolic demands. Means what will happen here, what is the function of the heart? The function of the heart is to collect the oxygenated blood from the lungs, and it will send the oxygenated blood to the various parts of the body. Means the heart will receive the impure blood from various parts of the body, then it will send to the lungs to purify. After it will get purified in the lungs, then again it will receive the heart. The heart will be pumped the oxygenated blood. But in what will happen in congestive heart failure condition means the heart cannot able to pump the oxygenated blood, means required amount of the oxygenated blood it does not able to pump to the various parts of the body. That is the problem in the congestive heart failure. It may be the due to many reasons, like due to the thickening of the walls in the heart. So in our heart there will be the four chambers, that is ventricle, left auricle, and right ventricle and right auricle. So it may occur due to the thickening of the walls or blocking due to the formation of the cholesterol or many other reasons. By this reason, we will get the congestive heart failure. So what are the signs? That is the lateral displayed apex beats and goal Pritham means additional heart sound. So generally the heart sound is loved up. So more than that we will hear the more heartbeat in this condition, and also the heart murmurs means indicates the presence of valvular defect and aortic stenosis means abnormal narrowing of the heart walls. So if the heart walls will get narrow means the blood cannot able to flow freely. At that time, what will happen means the pressure in the heart will be increases. So if the pressure in the heart increases means it will also dangerous to our heart. And also the pleural effusion means increases the volume of the pleural cavity, and also the pleural cyanosis means decrease the absorption of oxygen due to the fluid accumulation. Means what will happen in our heart if there is a more amount of the fluid is there, no? So at that time the heart cannot able to absorb the oxygen, and also it cannot able to pump the oxygen. So these are the signs. Let's see what are the symptoms. So symptoms what are there? That shortness of the breath, can't able to breathe properly, and dizziness, confusion, excessive sweating, increase of the heart rate, and accumulation of the blood or the fluid in the lungs, enlargement of the heart or the enlargement of the liver, and muscle fatigue. So these are the symptoms we will face when the patient having the congestive heart failure. Next, what are the types of the congestive heart failures? First one is based upon the amount of cardiac output. So, based upon the amount of cardiac output, in that there are two types. That is low output cardiac failure. Next, high output cardiac failure. So, in second one is based on side of heart affected. Means based at which side it is affected. It may be the right side or the left side. So let's discuss that what is the low output cardiac failure. So in this condition, the heart is normally functioning, but it cannot able to pump the oxygenated blood. Means that functioning is normal, but it cannot able to pump the oxygenated blood to the various parts of the body. In high output cardiac failure, what will happen means here due to some reasons like due to hyperthyroidism or due to the more amount of the cholesterol is present in the heart. So due to that reason, it cannot able to pump the blood to the various parts of the body. So in low output, what will happen is the functioning of the heart is normal but can't able to pump the blood. But in high output, due to the various health reasons like hyperthyroidism and more amount of the cholesterol present in the heart, it cannot able to pump. Next, based upon the side of the heart effect. So first one is left-sided cardiac failure. So in left-sided cardiac failure, what will happen means so in left side cardiac failure, what will happen means it cannot able to pump the oxygenated blood to the various parts of the body. Means it will fail to receive the blood from the arterial to the ventricle. And finally, what will happen means the ventricle left side ventricle cannot able to pump the oxygenated blood to the various parts of the body. That will happen in left-sided cardiac failure. Whereas on the right sided cardiac failure, what will happen means it cannot able to collect the blood from the various parts of the body. On the right sided article, right sided cardiac failure. So these are the types of the congestive heart failure. One is based upon the amount of cardiac output. Next, based upon at what side it is affected. It may be the right side or the left side. Next classification, so based upon the inotropic effect. First one is with positive inotropic effect. In this first one is cardiac glycosides. So example is digoxin and quinabine. So these are the drugs which comes under the cardiac glycosides. Next, phosphodiesterase inhibitors. In this example, inambrion and levomendan and melirion. So these are the drugs which comes under the phosphodiesterase inhibitors. Next, beta adrenergic agonists, that is dobutamine, dopamine and dopixamine. So these are the drugs which comes under the positive inotropic effect. What are they? That is cardiac glycosides and phosphodiesterase inhibitors and next beta adrenergic agonist. So next, without positive inotropic effect. So in this first one is angiotensin converting agents. So in this first one is angiotensin converting enzyme inhibitors, is also known as ACE inhibitors. What are the examples? Captopril, enalapril, ramipril, and lisinopril. So these drugs are also used, not only used in the treatment of the congestive heart failure, and also it is used in the treatment of the blood pressure. And also second one is beta adrenergic receptor antagonist. Example is bisoprolol, carvi, carvedilol, and meteorolol. So these are the drugs which comes under the beta adrenergic receptors antagonist. Next, diuretics. So in diuretics, what are the drugs will come? Acetazolamide, bumetanide, hydrochlorothiazide, and metolazone and spironolactone. These are the drugs comes under the diuretics. See the diuretics, the topics we have already discussed in the second unit. What are the diuretics and what is the mechanism and how it will work and what is main role in our body. Next, vasodilators. Example, hydralazine, isosorbide dinitrate, sodium nitroprusside, and nesritinide, and lesiltine, and tazociltine. So these are the drugs which comes under the vasodilators. And these vasodilators we have already discussed in the previous topic, like anti-anginal agent in the second unit. So these are the drugs which comes under the without positive inotropic effect. What are there? That is angiotensin converting agent, inhibitors and beta adrenergic receptors antagonists, diuretics and vasodilators. So these are the classification of the drugs which comes under the congestive heart failure. So next let's discuss that what is the cardiac glycosides. So what are the cardiac glycosides? These are the naturally occurring drugs. Means we can obtain these drugs naturally with positive inotropic effect. And this also termed as a cardiotonic. And also these are obtained from the various natural sources. Let's see what are the various natural sources. See here, maximum these are the natural sources, maybe the plant parts like from the seeds or the leaves or any part of the plant we are getting this drug. See here, digoxin and Gitalin and digoxin. So these are mainly obtained from the leaves of the Digitalis purpurea. Next one, that is digoxin and lanatoid C, which is obtained from the Digitalis lanata. And third one is propanthine G or vionabine, which is obtained from the seeds of the Stropanthus gratus. Next one is propanthine K, which is obtained from the seeds of the Stropanthus comb. Next, procylariidin A, which is obtained from the Argenia silica. Next, tevitin, which is obtained from the Tevita nidifolia. Next, bufotoxin, which is obtained from the Bufo vulgaris, that is store skin. So these are the cardiac glycoside drugs which is obtained from the natural process, like from the leaves or the seeds of the seeds parts of the plants. They are digoxin, uh, Gitalin and Gitoxin and Digitoxin and Lanatonide C and Stropanthus GKA, so etc. So these are the drugs which are mainly obtained from the plant source. Next, what is the general mechanism of action? So next one is general mechanism of action. So how the drug will be act in our body. So ionic movement occurring during the normal contraction of the cardiac muscle. So initially the calcium ion will enters into the cardiac myocytes via volt voltage sensitive L-type calcium channel. Such influx will stimulates the release of the large amount of calcium ions from the sarcoplasmic reticulum and the mitochondria of meiosis. So this results in the contraction of the cardiac muscle. So these are what will happen means due to the release of the calcium ions in our body. So what will happen means it will lead to the contraction of the heart muscle. So if we use the drug here, what will happen means the digitalis will get bound to the sodium or the potassium ATPase pump and it will inhibit its activity. So what it will do is it will inhibit the activity of the sodium or the potassium. So what will happen if the sodium levels are more in our body means it will results in the raising of the heart rate. So it is dangerous to us. So in order to avoid it, it will inhibit the activity of the sodium channel. So this results in the progressive accumulation of the intracellular sodium ions or the loss of the potassium ions. And due to this, what will happen? The deposition of the intracellular sodium ions or the calcium exchange pump will get activated. So what will happen? the exchange pump will be activated here, and also the sodium or the potassium pumps will be inhibited its activity by using the congestive heart failure drugs, for example, digitalis. So here what will happen means the digitalis will inhibit the reuptake of the calcium ions by the sarcoplasm reticulum. So I said no that due to the presence of the calcium ion, it may lead to the contraction of the muscle. So we should not require the contraction of the muscle. So that's why in order to avoid it, we are taking this drug in order to inhibit the reuptake of the calcium ions and also to inhibit the functioning of the sodium and the potassium channels in order to protect our heart. So the mechanism of action is nothing but here due to the presence of the calcium, sodium and the potassium channels, it will cause harm to our heart. So what will do the calcium due to the presence of the calcium? It will contract the heart muscles. So in order to avoid the contraction, we are using this drug, and also it will inhibit the functioning of the sodium or potassium channels. So this is a mechanism of action. So let's discuss first drug. What is the name? That is digoxin. So digoxin is the drug which comes under the cardiac glycosides. And see here IUPAC name 4, 3 and 5, 5, 4, 5 dihydroxy 6 methyl oxane 2YL oxy 4 hydroxy 6 methyl oxane 2YL oxy 4 hydroxy 6 methyl oxane 2YL oxy 12 14 dihydroxy 18 19 dimethyl tetracycloheptadecane 17YL furon 2-one. So this is the IUPAC name of the digoxin. See here, if you see in the structure. So here 4 is there. So here 5-member ring is there. See here furon. So this is a furon. In the furon, in second position, one oxygen is there. So it is furon 2-O. See here, in second position, oxygen is there. Again, in fourth position, and here 4 cycles are there. See here 1, 2, 3, 4. So this is the 4 cycles, that is, and here in the 17th position and then the 19th position methyl groups are there. How many are there? 2. So that is dimethyl tetracycloheptadecane structure. For this dimethyl tetracycloheptadecane, here in 17th position it is attached to the furon, and here in the third position, here oxane structure is there. See here, this is the oxane structure. In first position oxygen is there, and here in the 6th position methyl group is there. So this oxane structure at the 5th position. Another in the 4th position hydroxy is there. So it is named as 4 hydroxy. See here 4 hydroxy 6 methyl oxane, and here another oxane structure is there. Here in 6th position methyl and 4th position hydroxy is there. Here again to the 5th position the another oxane structure is attached. See here in 6th position methyl and 4th and 5th position hydroxy. How many? 2. That is dihydroxy 6 methyl oxane is there. See here 4, 3, again here 5, 5. Here 4, 5 dihydroxy. Dihydroxy means 2 hydroxy groups are there. So it is dihydroxy 6 methyl, and this is the structure of oxane. Here in the second position it is getting attached to the another structure. So it is 2YL, and here one of the oxygen is there. So it is oxy, and here again Fourth position, hydroxy is there. So 4 hydroxy, 6 methyl, oxol, oxane, 2 YL, and here oxy, and here 4 hydroxy, 6 methyl, oxane, 2 YL, and here 18th and the 19th position methyl groups are there. How many? 2. So it is dimethyl 18 comma 19 dimethyl 1 2 3 4. 4 cycles are there. So it is tetracyclo heptadecane. Here 17. So in 17th position it is attached to the furan. So 17 YL furan. In the second position oxygen is there. So it is 2-ol. So it is the structure and IUPAC name of the digoxin. Next properties, it is appears as the clear to white crystal or crystalline powder, means it may be available in the crystalline in nature or powder in nature. It is odorless, means it does not have any smell, but bitter in taste. It is insoluble in water and soluble in ethanol, freely soluble in pyridine, and also soluble in a mixture of the chloroform, alcohol, and it is more soluble in hot alcohol and slightly soluble in dilute alcohol, chloroform, and insoluble in ethyl acetone and ethyl acetate. Next, pharmacokinetics. So it is an oral and intravenous route of administration. So it is metabolized in the liver. So what will happen here? About 13% of the digoxin dose is found to be metabolized in the liver, and several urinary metabolites of the digoxin exits, including dihydrodigoxin and digoxidine bis digoxitose. So these are the metabolites, and also their glucuronidine and sulfate conjugates are thought to be proceed through the process of the either maybe follow the hydrolysis or oxidation and conjugation process. So it is what will happen here, it undergoes a metabolism by hydrolysis or oxidation or conjugation process, but the cytochrome enzyme does not play an important role in the metabolism of this drug, and it will finally excreted through the kidneys in the unchanged form. So here it is the, so it is the oral or intravenous and intramuscular route of administration, and it will get metabolized in the liver, but it does not undergo the metabolism by using the cytochrome enzyme. So it may get metabolized by hydrolysis or oxidation process, and it is excreted through the kidneys but in unchanged form. So next adverse drug reactions are dizziness, depression, confusion, feeling of anxiety, nausea, vomiting, diarrhea, headache, and rashes. So rashes will get because that in the pharmacokinetics we have said that it is the intravenous and intramuscular route. So at what side we are taking that injection, no, at that side we can see the rashes, weakness, irregular heart rate, and blood emission. So uses, it is used in the treatment of the heart failure and used to relieve the symptoms of the heart failure. So this drug is mainly used for the patient those who are not responding to the ACE inhibitors and diuretics. So this means some patients are there, no, they cannot able to give any response, means this drug will not act upon the patients, that is ACE inhibitors or diuretics. So for that person we should give this digoxin drug. So, and also it will reduces the heart rate and increases the cardiac output. Next, digoxin. So this is the structure of the digoxin, and if you see the IUPAC name 4 3 5 5 4 comma 5 dihydroxy 6 methyloxane 2 YL oxy, and here 4 hydroxy 6 methyloxane 2 YL oxy, 4-hydroxy 6-methyloxane, 2-yl oxy 14-hydroxy 18-19 dimethyl tetracycloheptadecane 17-yl furan 2-on. So if you see the structure here, so this is the furan. So for the furan in the second position, the oxygen is there. So it is furan 2-on. Here in the fourth position, the 14 hydroxy and 18-19 dimethyl tetrahydroheptadecane is attached. So this structure is attached at 17th position to the furan. So here 4, here 3, and here 5 and 5. So here at what positions we have the hydroxy 4 and 5? How many? 2. So it is the 4 comma 5 dihydroxy 6 methyl, that is oxane. Here in which position it is attached? It is in second position. So it is 2yl, and here oxygen is there, so it is oxy. And here in fourth position hydroxy. So 4 hydroxy 6 methyl oxane, and here in second position it is attached to the another structure. So it is 2yl oxy, here 4 hydroxy 6 methyl oxane 2yl, and here oxy, and here 14th position hydroxy is there. 1, so 14 hydroxy 18-19 dimethyl tetracycloheptadecane 17 yl furan. In second position oxygen is there, so it is 2-on. So it is a structure and IUPAC name of the digoxin. See here, if you see the compare the structure of the digoxin and the digoxin, the structure is almost all same. But where is the difference means for the digoxin, in the 12th position also one of the hydroxy group is attached in the 12th position. So 2-hydroxy is there, but in the digoxin only in the 14th position hydroxy will be there, but in the 12th position it is absent. So it is only the difference between the structure of the digoxin and the digoxin. The remaining structure and IUPAC name is same. Next properties, it is the white or pale buff microcrystalline powder, odorless, and it is bitter in taste and slightly soluble in water and soluble in ethanol, ether, chloroform, methanol, and pyridine. And pharmacokinetics, it is the oral route of administration. Absorption of this digoxin is decreased due to the presence of food in the stomach. Means this drug should be taken before the food. So if we taken after the food means what will happen? It will delay the absorption of the drug. Next, adverse drug reaction: dizziness, anxiety, nausea, and vomitings, diarrhea, headache, skin rashes, weakness, irregular heart rate, low platelet count, and visual problems. And uses, it is used in the treatment of the heart failure, and it is used to treat the certain irregular heartbeats, and also it will reduce the risk for the blood clots and also reduce the risk of the heart attacks. So these are the drugs which comes under the cardiac glycosides. What are their? Digoxin and digitoxin. So next one is vasodilators. So in vasodilators, mechanism of action is it will work on the different substances in the body to dilute the blood vessels. Means what will it will do means in this case what will happen, the blood vessels will get contract. So in order to release the blood vessels means in order to give the more space in the blood vessels, these vasodilators we are using. So it is easy to pump the blood or it is easy to receive the blood from various parts of the body. So what will happen? It will dilate the coronary arteries. So what it will do? It can help the more blood that reaches the heart muscle and dilating the leg vein. So it will lower the amount of the blood returning to the heart and limit the build-up of fluid in the legs. Next, dilating the systemic arteries. What it will do? That will carry the blood to the rest of the body, excluding heart and lungs. So it will easily carry the oxygenated blood to the various parts of the body by diluting the systemic arteries. Next, diluting pulmonary arteries, what will happen means it will reduce the amount of the work that heart needs. What will happen generally if there is a heart problem or like heart attacks or congestive heart failure, arrhythmiasis condition, the heart means it will pump forcefully to supply the blood or receive the blood to the various parts of the body. But if you dilate the pulmonary arteries means the heart can should need not to do that much amount of the work. It will reduces the workload to the heart. So this is the general mechanism of action of vasodilators. So in this first drug is necessary. So 1 minute. The drug name is Neseritide. So this is the structure of the Neseritide. It is a combination of the different enzymes and drugs. So it is structure is a combination of the different enzymes that will is present in our body and amino acids. It is a combination of the amino acids and the enzymes. See here, that is valine, histidine. So these are the amino acids. So it is a combination of the amino acids. So next properties, it is a white to off white uh, lip powder and it is bitter in taste and practically insoluble in water and soluble in ethanol. In pharmacokinetics, it is an intravenous route of administration and it undergoes the proteolytic cleavage of the peptide by endopeptides such as natural endopeptides which are present on vascular human surface. So human BNP is cleared from the circulation via three independent mechanisms. So what it will do, it will by binding to the cell surface clearance, receptors with subsequent cellular, and also second one is proteolytic cleavage and third one is renal filtration. So it is a intravenous route of administration. It undergoes the proteolytic cleavage of the peptide by endopeptidase by following the three mechanisms. It either may be the binding to the cell surface or proteolytic cleavage or renal filtration. Next, adverse drug reactions are headache, nausea, vomiting, skin rashes, itching, hypotension, sweating, anemia, and getting confusion, cough, increased creatinine level, and injection site reaction. So, this drug is taken through the intravenous route of administration. So, at that site, we will feel the site reactions like maybe the rashes or the swelling, anything, and uses it is used to relax and dilute the blood pressure, lowering the blood pressure and improve the breathing the people who are suffering from the congestive heart failure. Next, tezosentan drug. The drug name is tezosentan. So this is the structure, and if you see the IUPAC name N62 hydroxy ethoxy 5 2 methoxy phenoxy 2 and 2 1 comma 2 comma 3 comma 4 tetraazole 5YL pyridine 4YL pyrimidine 4YL 5 propane 2YL pyridine 2 sulfonamide. So this is the IUPAC name. We see the structure here. Here 6. See here in sixth position, 1, what is there? Hydroxy, ethoxy is there. So in sixth position, 1, 2. In second position, hydroxy is there. In the second position, hydroxy is there. See here, 1, 2. So two carbon atoms are there. So it is the ethyl group. For this ethyl, here oxy is there. So it is ethoxy. So 6, 2, hydroxy, and this is ethoxy. In here in the fifth position, that is methoxy, phenoxy is there. See here in the second position, the methoxy is there. So methyl group with one oxygen. So it is the methoxy, and this is the phenoxy. Group is attached at the fifth position, and here in the second position, the pyridine structure is there. In the second position, the pyridine structure is there. So to this pyridine in the second position, the tetrazole is there. So how many nitrogen atoms are there? 4. So nitrogen is named as aza. So 4 nitrogen atoms are there. It got what positions? 1, 2, 3, 4. So it is 1, comma 2, comma 3, comma 4 tetrazole. In the fifth position, it is attached to the 6-membered ring. So it is 5L, and this is the pyridine. So this pyridine in the fourth position, it is attached to the pyrimidine. So pyrimidine means presence of the 2 nitrogen atoms for the 6-membered ring. So this pyrimidine is attached to the pyridine in the fourth position. So it is pyrimidine 4L, and for the pyridine in the fifth position, how many carbon atoms are there? 1, 2, and 3. 3 carbon atoms means propane, 2L, and this is the pyridine. In the second position, the sulfonamide is there. Sulfur with 2 oxygen and 1 amide group. So it is sulfonamide. So this is the structure and IUPAC name of this drug. See, I will explain here again. 6, 2, hydroxy, ethoxy, 5, 2, methoxy, this is phenoxy, 4, here 2, tetrazole, this is pyridine, and here pyrimidine, and here 5, propane, and 2, sulfonamide. So this is the structure and IUPAC name. And properties, sir, it is a white, solid, viscous means it is more thick in nature. Hygroscopic means this drug should not be exposed to the atmosphere. And amino alcohol with an ammonical odor, and it is easily soluble in water. Next, pharmacokinetics, it is the intravenous route of administration, and it is metabolized in the liver and eliminated through urine. Adverse drug reactions are nausea, headache, hypotension. Uses, it is used in the treatment of the heart failures and used to improve the cardiac output. So next drug is besintan. So besentan drug name is, and this is the structure, and IUPAC name is 4 tetra butyl N 6 2 hydroxy ethoxy 5 2 methoxy phenoxy and 2 pyrimidine 2YL and pyrimidine 4YL benzene 1 sulfonamide. So IUPAC name is 4 tetra butyl N 6 2 hydroxy ethoxy 5 2 methoxy phenoxy and 2 pyrimidine 2YL pyrimidine 4YL benzene 1 sulfonamide. So this is the IUPAC name. Here 4 In fourth position, the how many carbon atoms are there here? 3 and here 1. So it is the butyl. In fourth position, that is the butyl, and here in the first position the sulfonamide group is there. See here in the first position sulfonamide, and this is the benzene structure. So here for this in the first position the pyramidine structure is there. So this pyramidine structure here in the sixth position the ethyl group is there. See here 1 2. So 2 carbon atoms means ethyl. So here in the second position of the ethyl hydroxy is there. So 2 hydroxy and this is ethoxy. Here in the second position the pyramidine structure is there, and here in the first position that what 2 methoxy phenoxy is there. See here in the second position the methoxy is there and this is the phenoxy structure. So I will explain it again. 4 tetrabutyl and here 1 sulfonamide benzene, and here this is the pyrimidine. 6 2 hydroxy and this is ethoxy, and here 2 so 2 pyrimidine 2yl, and here in fifth position 5 2 methoxy and phenoxy. So this is the structure and IUPAC name of this drug. And what are the properties? It is a white to yellowish powder and it is poorly soluble in water. Next, pharmacokinetics. It is an oral route of administration and it is metabolized in the liver and eliminated through urine. Adverse drug reactions are dizziness, allergic reactions and swelling. Uses: it is used to treat the blood pressure and it is also used to treat the heart failure condition. So these are the drugs which comes under the congestive heart failure, and these are the references books that should be followed for the congestive heart failure topic. So these are the references books. Thank you.